Hi and welcome. I'm trying to learn medicine. Today, enlarged adenoid. And after we've done it, we're going to do back stretching. And if you're participating in the back stretching, then it's at your own risk. And this is all no medical advice, we're just learning. And this is about internal anatomy and diseases. Now, before we're going to the enlarged adenoid, in the last part we had the acoustic neuroma, and that is a non-cancerous tumor, was it, I think, growing on the acoustic nerve in the ear, on the acoustic nerve, and it leads over time then to deafness and then more also death. The danger of removal increases as the tumor slowly grows bigger. So problems are if a tumor grows bigger, and the problem is that the tumor pressures onto the brain, which can cause dizziness and deafness, slowly onset of deafness, clumsiness, and so on. But the tumor, or the non-cancerous tumor, can be removed. But hearing loss happens. So now the question is, do humans have one or two acoustic nerves? Now we don't know where it is. It could be in the ear, then I would guess humans have two. But what if the acoustic nerve is in the brain? And I just want to point out this one thing. This idea to think about whether there's one or two. And how it would work. Now, probably this whole thing doesn't work for people who know it, whether humans have one or two. But just the idea that humans have just one acoustic nerve which processes what both ears are sending. Or that there are two acoustic nerves which then have to combine it someplace. So just the anatomical structure, just the whole setup of a structure, how it's built up, to think about it. I just think this idea is interesting. Now to the enlarged adenoid. The adenoid or adenoid or whatever is a single pad of lymphoid tissue. And lymphoid tissue, that is tissue that helps to protect the body from infection. Okay, that could happen, but that is mentioned a couple of times. Lymphoid tissue is tissue which protects the body from infections. Now this lymphoid tissue by adenoid, enlarged adenoid, lies at the back of the nose, close to the point where it joins the mouth cavity. Whatever, somewhere between nose and mouth. It is small at birth, but begins growing at about the age of 3. It would be interesting if it actually does not grow in the first 3 years. And what does it make it grow at the age of 3? And overall to the human growth. Are there any other things which start to grow at a specific age? And it would be interesting then to see that we're all next to each other, all of the 100, 200 things. But then, is there something else starting at the age of 3? So, why the age of 3? What does make it? Because there are a lot of things with teenage years, and when things start to get bigger and so on, and start to get more massive. Now the question is, or the interesting thing is, are there things which start then at another point during life to grow? At the age of 3, the adenoid. And now we basically can learn from it what are the mechanisms of making that grow at the age of 3, between the mouth and the nose, and what when during the teenage years, the height growth, more sudden and so on. Now, and it reaches maximum size at about the age of 8, and the puberty no longer causes obstruction. Why does it cause obstruction? Okay, don't understand that part. Whatever, it grows from the age of 3 to 8. Enlargement of the adenoid may block the opening of the eustachian tube, the tube that connects the middle ear to the throat into the nose, resulting in otitis media. So, the eustachian tube goes from the middle ear to the nose. And now this adenoid between mouth and nose can be too big, and then it blocks the entrance to this eustachian tube, and then the middle part of the ear between the eardrum and the ear doesn't get cleared anymore, gets infected, and otitis media. Besides, so middle ear infection isn't probably otitis media. The adenoid may also obstruct the flow of air from the nose to the throat. Obstruct the flow from the air from the nose to the throat, forcing the child to breathe through the mouth. So there can be some children who have to breathe through the mouth because their breathing through the nose is blocked through the enlarged adenoid. The flow of air through the mouth then causes the tonsils to become larger. The flow of air through the mouth. Now I don't know where the tonsils are, what the tonsils are. I would have thought these are the two openings of the nose, but why should they get bigger if the mouth is used? So, the symptoms. Breathing through the mouth, blocked nose, and snoring. And also nasal speech. Speech with sounds as though the nose is blocked. So not a completely clear voice, but a nasal speech. And also deafness and recurrent otitis media. Okay, the symptoms are breathing through the mouth, a blocked nose, snoring at night probably, and a nasal speech, so nasal speech, and deafness also, and recurrent otitis media. It would be interesting if an enlarged adenoid causes then both ears to go more deaf, and blocks both accession tubes to clear the middle ear. Deafness and recurrent otitis media. Then duration. Mouth breathing and a blocked nose may last for months. Okay, for multiple months, blocked nose and mouth breathing. Recurrent ear infections or deafness may occur over a period of months or years. Okay, these ear infections can happen from time to time. And also the deafness comes over months or years. It would be interesting if the deafness is then permanent. So gradually increasing or recurring, like the ear infection. Causes. Recurring or long-standing infection of the adenoid. Now, it is infection. Now, it would be really interesting. Is it really the only cause? Is there no genitals, so nothing with birth, nothing with the genes? Is it actually infection causing the adenoid to get larger? Whatever. Recurring or long-standing infection of the adenoid. Complications. Repeated ear infections and deafness. So the complications can be deafness and also ear infections. And then also deafness can lead to speech impairment and so on, so other problems. Treatment in the home. There is no home remedy for enlarged adenoid. Home remedy. I'm not really familiar with the word remedy. I heard it a couple of times, but I don't know what it means. There is no home remedy for enlarged adenoid. It is a normal process of childhood and is best ignored unless there are complications. Do we actually say that an enlarged adenoid is a normal process during childhood? Maybe if it is actually just during infections. Whatever. If it does not make complications, they advise to ignore it, but this book is 40 years old and this is not medical advice. When to consult the doctor. If a child has earache or deafness in one or both ears lasting more than 4 or 5 days. Okay, earache or what was the other thing here? Ear deafness, no, what was it? No, yes, ear deafness for more than 4 or 5 days. And also, if the nose is blocked for more than a month and the child is unable to breathe with the mouth closed. So if the child cannot breathe through the nose, I don't want to get offended why I say that, I wouldn't even wait a month. By saying if mouth breathing lasts for longer than a month and the nose is blocked for longer than a month. What a doctor might do. Examine the ears and mouth. Test to see how well the child can breathe through one nostril at a time. Testing the hearing. Send the child to an ear, nose, and throat specialist. So basically it's testing how the nose is breathing and the ears and the mouth. Just because many things are connected. Because it's oftentimes called, I don't know what the proper name is, but nose, throat, ear, doctor, whatever. Why is optics not included? Optics is a specific science, but just the idea, if nose, throat, and ears are so connected, why not take a look at the eyes? Send the child to an ear, nose, and throat specialist. The specialist may decide that an operation is necessary to remove the adenoid and possibly the tonsils at the same time. I don't know what the tonsils are, so it can't be the opening set for nose. Recovery is usually rapid, so the recovery is rapid, and maybe a removal of the adenoid is then done. But this is 40 years old. Again, maybe there's something new developed. And also the tonsils. Now to the adenoid. Does the adenoid have a function? It is a lymphoid thing, so does it make then the infection protection less if it is removed? Outlook. From the age of 8, the adenoid decreases size and both risk for... Why does it decrease? What function does it have from the age of 3 to 8? Imagine the adenoid has actually the function from 3 to 8 to be supportive in defending against infections during childhood. just the idea that there is an organ or lymphoid or whatever, which is specifically there just during childhood to protect. Whatever, I don't really think that that is the reason why the adenoid, what is it even? Adenoid, is that the ground? The adenoid, a pet of the adenoid lymphoid tissue. I don't think that is the reason why it exists. It would be interesting to know what the function of it is, a part of the lymphoid system. Now, what is really, actually the one system? Why is it where? Why not somewhere else? There are other types of lymphoid tissue, probably. So from the age of age, the adenoid decreases in size, and both the risk of complications and symptoms decrease. The specialist's decision to operate on it depends on reaching a balance between symptoms and age of the patients. Why? Because the operation has a part of the surgery itself complications, and it has some back effect. That would be interesting. Okay, there has to be found a balance, and again, this is 40 years old, this book, so maybe there's something better already found. And we're also advising to look to the respiratory system at page 42. That was 22 pages previously. We didn't do it. We're going to do it at some time in the future. Now, that was the enlarged adenoids, or a little overview of it. Adenoid. Now, we're going to do the backstretching. If you were here for medicine, then you can go directly to the next part. We will do now the backstretching. If you participate in the backstretching, then it's better the arm is good and set it stand and we lift the arms up. And breathe out, going over to one side. And breathe in and over the rib cage. And out back into the middle. Breathe again in. And out over to the other side. Breathe in and out the rib cage. And out into the middle and the arms down. And now next exercise, now on the actor, breathe in. And out with one hand slides down the leg, and the other shoulder stays down. Then breathe again in. And now we're taking one arm over. Breathe in and out the rib cage. And out back into the middle. Breathe again in. And out, first breathe in. Slide down. Breathe in. Out, take one arm over. Breathe in and out the rib cage. Out back into the middle. And now we are having the feet standing together. We're doing the aerobatic aeroplane. We're breathing and lifting the arms up. And breathe out, one hand down. Breathe in and reach. And out again. Again in. And out, one hand down. Breathe in and reach. Out, one hand up. And again in. And out, one hand down. Breathe in and reach. Out. Again in. And out, one hand down. Breathe in and reach. And out, and hands down. And now the legs wide apart, and we're doing the marker. Now we're going to fit in together. We're doing the the arms up. And breathe out, lean back, draw the shoulder blades together and up the chest to sky. Again in. Our cross the arms and intertwine the fingers, reach high. And breathe out, reach in front, hold of the back. Again in. Now leaning again back, draw the shoulder blades together. Again in. Our cross the arms and intertwine the fingers, reach high. Breathe out, reach in front, hold of the back. Again in, the arms up. And out, the arms down. And we're doing the sky cutter. Breathe in, the arms up. Breathe out, the arms back, up, chest to the sky. Again, in the arms up. And out, the arms back. Again, in the arms up. And out, the arms down. And we're ending with a cactus collecting its things at the end of the evening. Breathing in, lifting the arms up. Bring the hands together. And we're breathing out and bringing the hands down towards it. That was a backstretching. Now, I don't think that the answer to the existence of the adenoid livoid tissue is that it is there to protect the child during childhood from 3 to 8 against infections. Because why then not keep it longer? And not just to decrease it, and maybe it gets more affected and can be decreased. Whatever. Why then not keep it during the whole time? But it is kept during the whole time, whatever. So I don't think the answer is that simple, why it exists. I thank you very much, and until next time.